Good to see you, Chris.
Yes, ma'am.
Joining us now, Austan Goolsbee, who is President Obama's chief economist, along with Avik, one of the country's foremost experts on health policy and a health advisor to 3 Republican presidents. Great to see you both. So let me start with you on this, Avik. We had you on all the time when we launched the Kelly file, and Obamacare was a big story, and it was having problems, the rollout and so on. And you were predicting left and right that that it wasn't going to work, that there would be rate hikes, that the premiums would go sky high, that there would be rate shock. You were mocked as having launched a cheap and misleading shot. Do you feel vindicated, and how did you know?
Well, I mean, I'm not at all happy to be right. I feel very sorry for the people whose premiums have, on a cumulative basis, gone up on an average of 126% over the last 4 years. We've been talking about this 25% or 22% rate hike for 2017. The cumulative effect since Obamacare went online is an average of 126%. So yes, there are some people whose incomes are close to the poverty line who are benefiting from taxpayer-funded subsidies, so they're not going to see those premiums. But for a lot of people in the middle class, a lot of people who are struggling to afford health insurance, they're seeing big hikes. And that's why when Obamacare was launched, the Congressional Budget Office projected that 21 million people would be enrolled in these exchanges. Only 12 million people are as of 2016.
What about that, Austan? The numbers have fallen short considerably, and you can hear the consumer displeasure when you talk to folks who are suffering these rate hikes.
Yes, I'm not disputing that there are markets where they have had less take-up than was predicted, and that's why those costs are coming in higher.
Right, they don't have enough healthy people in the risk pools.
I think this is misleading on 2 counts. I think this is, be a little careful. First is, this is only for people who are buying their health care on the exchanges. It's around 3% of the country. For 97% of the country, what we're talking about here has no bearing on them at all. And healthcare cost inflation overall in the economy has been the lowest in 50 years. And the second is, these rate increases are high percentages, but the overall affordability in most of the markets is still quite good. So you got more than 70% of people are able to buy health insurance at less than $75 a month, which is far less than what they were able to buy it for before there was Obamacare.
Avik is smiling.
What most people are able to buy it.
It's not the nice kind of smile. It has a tinge of mocking to it. Go ahead, Avik.
Well, not mocking, but, you know, there are about 30 million people who are supposed to enroll in exchange-based insurance under the original projections, and another 10 million people who are supposed to buy insurance in the off-exchange individual market. That's more than 13% of the country, not 3% of the country, and those are the people whose premiums are going up. Austan mentioned that, yes, 70% of the people who are signed up now are benefiting from subsidies, but there are tens of millions of Americans who aren't signing up because they can't afford the premiums, they can't afford the copays, they can't afford the deductibles. So this problem is going to continue, and I think what's going to be very interesting is in 2017, in 2018, have we reached a plateau of how many people will sign up for these Obamacare-based exchanges? And another thing I should mention, Megan, is that, you know, people talk about these subsidies. Well, these subsidies are going to cover everything. The subsidies over the long term only grow at a formula that's indexed to inflation. So if premiums on the exchanges go up 6–10% a year,
your point is they're not going to cover everything.
They're not going to cover
everything. Austan, I'll give you the final word.
Well, all I'll say is what matters is the overall healthcare cost inflation rate, and if we maintain the affordability, then they will work. If we don't and we can't get people to sign up, we will have to fix it. But for the people who lit the burgers on fire, those aren't the people who should be complaining the meat is overcooked. Republicans are discouraging people from signing up, so it's happening in red states.
Great to see you both. Thank you.
Thanks, Megan.
Still ahead, Sheryl Crow